So what do we do in the caloric testing? We are going to stimulate the semicircular canal, the horizontal semicircular canal, with warm and cold temperature. It may be through water or air, because of which there is a movement of endolymph. The endolymph is going to move because of this temperature change, and it's going to either stimulate or it's going to either inhibit, depending on which direction the fluid is flowing, right? If the cupula is deflected towards the utricle, it's an excitatory stimulation. If it's away from the utricle, it is inhibitory response. So depending on which side the endolymph is moving, the cupula will move accordingly, right? So we are going to stimulate the semicircular canal, horizontal semicircular canal, with temperatures warm and cold, and it is going to create a movement of endolymph, and then it's either excitatory or inhibitory. And because of this, we are going to have nystagmus, and we are going to record the nystagmus. And based on the nystagmus, we are going to see if this is normal or abnormal. This nystagmus will be present even for normals. Okay, if you want to see if your eyes can have nystagmus, you can do this caloric and you will have nystagmus. Okay, the normals and the abnormals will have a different kind of nystagmus. That's it. Okay, so before we do this, we need to check the ear canal and the tympanic membrane. Why? If there is an ear wax, then we will not be able to do anything, because whatever we stimulate, it will not reach there, right? If there is a perforation in the tympanic membrane, then again it's a problem. Okay, so we have to check all these things. If there's a grommet insertion, okay, if there's a grommet insertion, then what happens? It will also the water go into the middle ear pathology. It will result in a problem, infection, all those things, right? So we have to check ear canal and tympanic membrane before we are doing caloric testing. Okay. So when we are doing a caloric testing, we have to check for the ear canal and tympanic membrane. Ear canal, because if there is an earwax, we cannot do the caloric testing at all. Okay. If there is a perforation or there is a grommet for the myringotomy, when we do a myringotomy, we keep a grommet, right? So that any pus in the middle ear will come out. For the children, usually we do it for the children. So when you have perforation or this grommet in the tympanic membrane, if you're pouring water into it, it will go in the middle ear and increase the infection, right? So we have to check with the ear canal and the tympanic membrane, and it will help us either to terminate the caloric testing if we really cannot do in case of earwax, or choose between water or air. Okay, so we have water, which is the easiest one, because when you pour, it will directly go into the ear and touch the tympanic membrane. We don't need to do anything. But if it's an air, then we need to know the anatomy of the patient's ear canal, and we have to blow the air on the tympanic membrane. And again, the speed of the airflow is also controlled. The speed of the water is also controlled, because if you're gushing the water, then it will tear the tympanic membrane. And if you're blowing very heavily, it will also tear the tympanic membrane. So it's all under the control. Okay, it's a slow introduction of this air or water. Okay, in case if it is a perforation tympanic membrane, we can use air. Okay, fine. So the difference between the water and the air will be 6 degrees. Okay, if you're using 44 degrees warm for the water, we will use 50 degrees Celsius as air in the warm. And if it's 30-degree cold water, then we have to use 24 degrees Celsius, which is 60 degrees lesser cold air. Okay, why? Because you can see here, we are presenting a water of 44 degrees Celsius here, right? This is a tympanic membrane. And then it is middle ear. When we present here, the temperature will slowly come down. Okay, so your horizontal semicircular canal is in connection with your middle ear. Okay, it's closest to the middle ear. Okay, and it is closest to the ampulla. Fine. So when it reaches here, it will be 37 degrees Celsius. Okay, how does this create the endolymph flow? A fluid, when it is heated, okay, the volume becomes more, the volume is increased. So what happens when the volume increases, it tries to flow in a less volume space. So it is going to stimulate the cupula in this direction because it is trying to exit. Okay, and it's trying to exit, it is going to deflect it towards the utricle. So it is going to get me a excitatory response. Okay, if it is less, if it is cold water, then what happens? The volume reduces. So what happens? The other endolymph, which is not exposed to this temperature, will try to come inside. So the cupula will be deflected away from the utricle in this direction, where my pointer is being shown, and this direction. So inhibitory responses. Okay, which means the warm water will produce excitatory response in the ear which you are presenting the stimulus, and inhibitory response on the other side. If you are using a caloric response in the cold water, if you're using recording a caloric response to the cold water, you will have inhibitory response on the ear where you are presenting the water or air, and excitatory on the other side. Okay, that's why we have this term called, just a minute. Okay, one slide is missing. I'll say it as COWS, COWS. Okay, which means cold opposite and warm same, COWS. Cold opposite, which means opposite side, it will be excitatory if you're introducing cold, and warm same side excitatory if you're using warm. Okay, what do we do then? This is how the responses will be. Okay, now tell me, what side beating nystagmus is this? Is it right beating nystagmus or is it left beating nystagmus? Tell me what is A and what is B. How do we know which side is beating? We have slow and fast component. The slow component is inclined and the fast component is almost vertical. Look at here. Which side has flat and which side has slope? This is a slope. Okay. Which direction it is coming? Down direction, which means down means left. And which direction is going? Fast, vertical, up, which means right. So this is right beating nystagmus. As I said, when you present warm water on the right side, it will create excitatory on the right side. So right warm, right beating nystagmus. Okay, fine. Here, look at the sloping one. Sloping one is towards, always you have to see on the right side, I mean, towards the right side. Okay, from here to here, not here to here, down to up, which means left to right, not right to left. Okay, so left is this, the next point is here, so it is up, and this is sloping. This is slow faces on the right side, and from here to here suddenly coming down, which is left. So left beating nystagmus. As we told already, the right cool will produce inhibitory responses on the right side and excitatory response on the left side. So you are getting a left beating nystagmus. Okay. So what I previously told you, that we will measure slow component I velocity, right? So what is here? This caloric response is interpreted mainly with the help of this SCV, slow component I velocity. Okay. And it is also called as SPV, slow phase velocity. Okay. SCV is slow component I velocity and SPV is slow phase velocity. Okay. So we will be doing it individually and we will have 10 minutes break in between, which is we will have right warm and then we will go right cold and then we will have left warm and then we have left cold. But in the order of doing it, we will do it like this: right warm, left warm, right cold and left cold. Okay, fine. This is your butterfly chart. Okay, we previously saw how to calculate your SCV. I hope you remember. If you don't remember, let me know. I will show that it's there previously. Okay, so we have how to calculate SCV. So from this graph, we will calculate SCV. Once we have calculated, we will have four numbers for four different conditions: right warm cold, left warm cold. So we will plot it accordingly here. Your red means your right, left is your, left is what? Blue is your left. Okay, so this is your baseline. Okay, if the crossing of these two things falls within the box, it is normal. If it is going out of the box, it's abnormal. Okay, so this is your velocities. All these are in velocities, left velocities. Okay, right here and left here. Okay, let's see the numbers next. So imagine the SCV for the right worm. When we did a right worm and we recorded a nystagmus and we saw it is 27. Okay, so right worm will create a right beating nystagmus. Okay, so we will mark it in this area. 27, done. Then we will do left worm. We will left worm will create left beating nystagmus. So we will have left side and we will mark it as 26. Okay, then we will do right cold. It will create left beating nystagmus, opposite side beating nystagmus. So we have 29, we marked here. And then left cold will create again right beating nystagmus. We have this one. So we have 37, we marked it. And we try to join these two lines and we see where it is intersecting. It's intersecting within the box. So this is normal caloric irrigation. This person has normal caloric irrigation. Along with that, we have two other things: unilateral weakness and directional preponderance. Okay, why are we doing this? We need to know which horizontal canal is stronger. Okay, we need to know if the both are responding equally or one is responding better. One side is better or equal. Okay, so we use this formula. Okay, unilateral weakness, we have our SCV recorded, right? We have our SCV recorded. We will have here, we just have to substitute the values, and we have to see the percentage. So we will multiply by 100, and if it is less than 20 and 30, the unilateral weakness is less than 20 or 30, the difference between the right and left is 20 or 30, then it is acceptable. Okay, if it is more than 30, it's definitely pathological. One side is more stronger than the other. Few clinics take 20 as the point, 20 as the limit. If it's 25 percentage, then they consider it as unilateral weakness. Few clinics take it till 30 degree. Okay, so it all depends on the normative values. Okay, we have to do caloric irrigation for normals. Okay, if we know they have no vestibular complaints, we will do it on them, and then we will calculate the unilateral weakness, and then we will check what is the normal values, and then we will decide if we have to take 20 or 30. The next one is directional preponderance, which means the unilateral weakness is about the side. Okay, this directional preponderance is about the sensitivity of the semicircular canal, horizontal semicircular canal to a particular stimulus. Okay, so that's why we have taken right warm and left cold, and then left warm and right cold. So we know how the nystagmus is beating, which means if we stimulate right warm and we stimulate left cold, we are going to have right beating nystagmus. If we stimulate the left warm and if we stimulate the right side with the cold water, we are going to have left beating nystagmus, right? So we are comparing these two. Again, 30% difference is considered as directional preponderance, which means one side, one side nystagmus is more stronger than the other one. Okay, this unilateral weakness and directional preponderance is not important one. Okay, this is like your gradient in the tympanometric. What is most important? Compliance and peak value. So what is more important is your SCV. Gradient, yes, important, but not that much important. Likewise, we have unilateral weakness and directional preponderance. Okay, so this is the last slide. We are done with our ENG and VNG. If you have any doubts, please post it. We'll try to answer.